Okay, imagine your heart is this perfectly rehearsed orchestra, right? Every single beat, every contraction is perfectly in sync, all led by a master conductor. But what happens when some of the musicians decide to go rogue and start their own rebellion?
So what does happen when your heart's rhythm just goes completely off the rails? Well, that's exactly what we're diving into today. Atrial dysrhythmias. This is a rebellion happening in the heart's upper chambers. Let's get into it.
But first, to really understand the rebellion, we have to appreciate the piece. So let's start with the heart's conductor and figure out what a normal, healthy rhythm actually looks like.
And that conductor is the sinoatrial node. You'll hear it called the SA node. This is the heart's natural pacemaker. It's this tiny little spot in the right atrium that sends out the electrical spark for every single heartbeat, keeping the whole orchestra playing in a steady, beautiful, consistent rhythm.
Okay, but sometimes other cells in the atria, they get a little irritable. They get ideas of their own and decide, hey, I want to lead. They start to challenge the conductor. So what causes this rebellion in the atria to even start?
Well, a whole bunch of things can stir up trouble. Think of these as triggers that encourage those rogue musicians to just start playing out of turn. This can be anything from stress, or if your electrolytes are out of whack, to certain drugs like amphetamines, even stuff we consume all the time like alcohol and caffeine, or conditions like chronic lung disease. All of these can make those atrial cells cranky and ready to start their own chaotic symphony.
And now for the really interesting part. Let's pull out our field guide for these rhythms and learn how to spot this uprising on an EKG.
So our first and honestly simplest form of rebellion is the premature atrial contraction, or PAC. The best way to think about this is like a single musician hitting a note just a little bit too early. It's just one offbeat note in an otherwise perfect performance.
And this EKG shows it perfectly. See that steady, underlying rhythm? It's going along just fine. And then, bam! That arrow is pointing to one beat that just shows up a little too soon. What's kind of cool here is that the P wave for this early beat often looks different from the others, and sometimes it can even get hidden inside the T wave of the beat that came right before.
So, to wrap up PACs, the main rhythm is regular, but that one early beat makes it feel irregular for a second. The P wave looks weird, but the good news is, a lot of the time it doesn't need any treatment. But, and this is a big but, a sudden increase in PACs can be a warning sign that a more serious rebellion, maybe like atrial fibrillation, could be just around the corner.
Okay, let's move on to our next rhythm and see how this whole thing can escalate. We're going from a single offbeat note to something way more organized, atrial flutter. This is an organized rebellion,
And I mean, you just can't miss this one on an EKG. Seriously, just look at that classic sawtooth pattern between the big QRS complexes. Those are the flutter waves. It's not a normal P wave at all. It's this rapid-fire signal coming from one single rebellious spot in the atria.
So here are the key facts. The rhythm is usually pretty regular, but the atria are firing at an insane rate. We're talking 250 to 400 beats per minute. Now, thankfully, the AV node acts like a bouncer at a club door, and it blocks a lot of those signals from getting down to the ventricles. If it didn't, the heart rate would be dangerously high. And because you have those sawtooth waves instead of P waves, you can't even measure a normal PR interval.
And now, for the most common and by far the most chaotic rebellion of them all, atrial fibrillation, or AFib. In this one, it's not just one rogue musician, it's hundreds of them, all playing their own tune at the same time. It is absolute chaos.
So take a look at this EKG strip. What's the first thing you notice? Or maybe what don't you notice? Yeah, there are no clear P waves. They're gone. That baseline is just wavy and chaotic. And because the signals that manage to get through the AV node are completely random, the rhythm is what we call irregularly irregular. There's absolutely no pattern to this madness.
Okay, so let's put our two major rebellions side by side to really lock this in. With atrial flutter, you've got a rhythm that's usually regular with that classic sawtooth look. With AFib, it's totally irregular with that messy, wavy baseline. The atrial rate in AFib is even faster, we're talking over 400 beats per minute. But the most crucial difference for both? The risk of stroke, which is especially high in AFib. So why is that stroke risk so crazy high? Well, it all comes down to this one simple, powerful fact. In AFib, the atria don't actually contract. They just quiver.
And because they're just quivering instead of pumping like they should, blood doesn't move through them properly. It starts to pool and just sit there, especially in this little pouch called the left atrial appendage.
And what happens when blood just sits around and doesn't move? It clots.
And this is what dramatically increases the risk of those clots breaking off, traveling up to the brain, and causing a stroke. This is, without a doubt, the single most dangerous part of atrial fibrillation.
Okay, so we've identified all this chaos. Now, how do we restore law and order? Let's take a look at some of the treatment strategies.
Medication is usually the first line of defense. We've got drugs like beta blockers or deltesem to control the rate. That's basically telling that AV node bouncer to be even stricter. Then we have drugs like amiodarone that try to convert the rhythm back to normal. And of course, most importantly for AFib, we use anticoagulants, blood thinners, to prevent those really dangerous clots and strokes.
But sometimes you just need to hit the big red reset button, and that's called cardioversion. Think of it like a hard reboot for the heart's conductor. First, the patient is sedated so they're comfortable. Then, a synchronized shock is delivered to the heart. This jolt basically silences all that chaotic electrical noise, giving our true conductor, the SA node, a chance to wake up, reset, and take back control.
All right, I know that was a lot to take in, so let's bring it all together with a quick summary of our dysrhythmia field guide. Here it is, your cheat sheet. For PACS, just remember that one single early beat. For atrial flutter, think rapid, regular, and those classic sawtooth waves. And for AFib, the big telltale signs are that chaotic, irregular rhythm and the wavy bass line with absolutely no P waves. It's really a simple way to keep the key differences straight in your head.
So, we've seen what happens when the heart's orchestra just falls apart. And that brings us to a final question to think about. If your heart really is an orchestra, what can you do in your own life to help keep your conductor healthy and the rhythm strong?